Hi, I'm Dan English, the Program Coordinator for the Missouri Local Science Engagement Network. I want to talk to you about how elevating the role of science in policy discussions can lead to racial justice, equity, and inclusion. As an organization, one of our main focus areas is health disparities, and one of the most glaring health disparities in Missouri is the maternal mortality rate. The United States is facing a crisis in maternal mortality. Take a look at the number over time. Maternal mortality is defined as the death of a mother postpartum within 1 year of giving birth. The death rate in the U.S. jumped from nearly 20 per 100,000 in 2016 to nearly 30 in 2019. Missouri is emblematic of the larger problem in the United States, up from 28.5 per 100,000 in 2016 to more than 40 in 2019. Right now, Missouri ranks 44th out of all the states for maternal mortality rates. Here's the big racial equity problem. Disparities in health outcomes between black mothers and white mothers are the reason Missouri is lagging behind. Black women in Missouri are nearly 3 times more likely to die within 1 year of giving birth as white women. The disparity between black women and white women in the rest of the country isn't much better. Black women are a little more than twice as likely to die. What's driving this disparity? Health researcher, nurse practitioner, and lawyer Sue Kendig told us the reason is not socioeconomic. She says communication is lacking between healthcare providers and minority women. Moreover, black women are more likely to be scolded by their healthcare provider, and that can reduce patient compliance, not to mention trust in the patient-doctor relationship. Other than racial health equity, why else should we be worried about this? Simply put, maternal mortality is an overall indicator of the quality of the healthcare system in any state or country. Poor practices and lack of standardized healthcare protocols are often cited also as reasons for poor maternal health outcomes. I touched a little bit on it earlier, explaining how some clinicians might be more inclined to scold black and minority women. Statistics show clinicians may not fully understand the cultural and socioeconomic differences that might lead to different maternal health outcomes. So implicit bias is a significant contributor to healthcare disparities. So what have policymakers done to address this problem? Right now, Missouri Health Net pays for 38% of all births in the state. That number is likely to rise with the Medicaid expansion. This past summer, Missouri voters approved Medicaid expansion in the state. The new rules will mean mothers earning up to 196% of the poverty level will be eligible for mother and child care paid for by Medicaid. That's a start. These moves may decrease maternal mortality for everyone in Missouri, but our mission as an organization is not to advocate for any policy position or specific policy. Our role is to elevate the discussion of science and policy decisions. For example, if a Missouri state or local policymaker is interested in improving statistics in the state, we point them to research and science-based policies around the problem. Research shows specially trained community health workers and frontline health workers in the Promotores de Salud initiative can improve access to healthcare and healthcare outcomes for minority women. This is just one way science-based solutions can promote racial health equity in our state. The Missouri Local Science Engagement Network helps STEM professionals identify opportunities to engage civic and policy leaders in the role and use of evidence-based perspectives in finding locally relevant solutions. We are a joint project of the Missouri Science and Technology Policy Initiative and AAAS. Our membership serves as a complement to the MOST Policy Initiative, a group of 5 fellows working in the state capitol, serving as ambassadors to science on committees and providing testimony on science topics to the legislature. Now, a shameless plug from us. The Missouri Local Science Engagement Network is hosting a science communication training series in partnership with AAAS. We're looking for Missouri-based researchers and scientists to participate in training centered on communicating climate science and climate science advocacy. It's provided by the American Association for the Advancement of Science. We're gathering over Zoom on December 3rd, December 17th, and January 7th. You can sign up at missouri.lsen.quorum.us. I'm Dan English. Thanks to NSPN for this opportunity, and enjoy the rest of the Flash Talks.